a commitment to excellence in care for patients, families, and the community. Now, the latest in medical innovation and information for your good health and well-being. This is KMAX Healthcast, sponsored by Covenant Health.
When you cut yourself or you fall down, the wound usually heals pretty fast. But for some people, these wounds don't heal, and extra treatment is needed before the situation gets very dangerous.
And it was
just a few months ago, Tom Griffin wasn't sure if he'd ever be able to get a sock and shoe on again.
If I'd have let it go, could have lost a foot.
Griffin is diabetic, which means it's harder for wounds to heal. So when he stepped on a nail and it didn't get better, he knew something was wrong.
Kept getting redder, infection. And also it started streaking up my leg, the redness. So it was getting dangerous.
If you have a non-healing wound for 4 to 6 weeks, your chances of getting better go down at least like 20%.
Dr. Jesus Hidalgo with Covenant's Wound Care Center says stories like Griffin's is very common.
You get patients that have open wounds for months and even years. The patient has been here approximately 2 hours.
After getting more antibiotics, Griffin started coming here. He started getting hyperbaric treatments, which pumps extra oxygen into the body.
What that is going to do with the patients with a diabetic ulcer or with a non-healing wound, increase their oxygen levels in the plasma 3 to 5 times. So that is going to help them to release growth factors like the tissue growth factor, vascular growth factor from the bone marrow. And he did well. So we were able to save his foot, avoid all the morbidity that comes with an amputation of the lower extremity.
So 5 months later,
this foot, I'm feeling good. Now I can run around, doesn't hurt.
Griffin is back to normal, and he says he's thankful he went in to get the help he needed.
I would say if you're diabetic or elderly, if you get a wound, go have somebody check it out that knows.
And make sure you go talk to the doctor.